There's a type of pain out there that's so specific it can make just sitting down unbearable. And a lot of people who have it suffer in silence, feeling like nobody really gets it or takes them seriously. It's called coccydynia, basically tailbone pain, and it can totally derail your life. So in this explainer, we're going to break down exactly what it is, where it comes from, and, this is the important part, the actual evidence-based steps you can take to get relief.
Yeah, at its core, this is the kind of thing that literally turns chairs into your worst enemy. Just picture it, this sharp, nagging pain right at the base of your spine every time you sit, lean back, or even just try to get up. It makes everything work, hanging out with friends, even just relaxing at home feel impossible. And for so many people dealing with this, figuring out why it's happening feels like a total frustrating mystery.
Okay, so let's get specific here and give this thing a name. Medically, it's known as coccydynia, and what that means is pain specifically in the coccyx. That little triangular bone at the very, very bottom of your spine. We're not talking about a general lower backache here. No, this is a really precise, often sharp pain right on the tailbone. Now, get this. When you look at who this condition affects most, the numbers are pretty shocking. It's a 5-to-1 ratio. For every one man who gets diagnosed with coccydynia, 5 women do. That is a huge difference, and it really points to things like the anatomy of the female pelvis and, of course, the trauma that can happen during childbirth.
So, what's actually causing this? Well, the number one trigger, by far, we're talking over half of all cases, is a direct trauma. A really hard fall right on your butt. But that's not the whole story. As we just mentioned, childbirth can definitely be a cause. And then there are two sides of the same coin, both obesity and this might surprise you, rapid weight loss. Why? Because when you lose that natural padding, it can leave the tailbone more exposed and vulnerable. And this is so important. We're not just talking about physical pain here. There's this huge emotional weight that comes with it, because it's an invisible injury, right? And the pain is in a pretty private spot, so a lot of patients say they feel completely dismissed by doctors, by their family, even at work. They get told it's all in their head, and that just makes everything so much worse.
So how do you break through that? Well, it all starts with getting the right diagnosis. This is the key to turning this frustrating mystery into a clear plan of attack. So let's dive into how you actually find the real source of the pain.
Okay, a proper diagnosis isn't guesswork. It follows a really clear 3-step path. First, a doctor needs to take a detailed patient history. That means actually listening to your story about the pain. Then comes a physical exam, where they'll carefully press on the tailbone to see if they can reproduce that exact pain. But honestly, it's this third step, dynamic functional imaging, that is the absolute game changer. And this is exactly why so many people go undiagnosed for years. Think about it. When you get a standard MRI or a regular X-ray, you're usually lying down, right? There's no pressure on your tailbone. So in that position, everything might look totally normal. The real issue isn't what the coccyx looks like when you're resting. It's what it does when you're sitting on it. And here is the big reveal. The solution is something called a dynamic X-ray. They take one picture of you standing up and then another one while you're sitting down, putting pressure on it. Just look at the difference. On the right, in that sitting position, you can clearly see the tailbone is unstable. It's actually moving out of place. They call it subluxating. That movement, that is the direct cause of the pain. And seeing it right there on the film, that's the concrete proof that both patients and doctors have been looking for. Okay, so once you have that crystal clear diagnosis, everything changes. The path to treatment suddenly makes perfect sense. And the first line of defense is always going to be the conservative stuff. Non-invasive physical therapies. And the great news is, the research shows they can be amazingly effective. And hey, we're not just pulling this out of thin air. The info we're about to go over comes from what's called a systematic review. Basically, it's a study of all the best studies. And what it found was, there are several physical therapy techniques that give people significant relief, particularly in the short term.
This table breaks it down really nicely. You've got manipulation, which is where a trained physical therapist actually physically realigns the coccyx. And look, that helps in both the short and long term. Same goes for internal massage of the pelvic floor muscles. There's one called the levator ani that can get really tight and pull on the tailbone. Releasing that provides lasting relief. Then you've got other things like shockwave therapy and kinesiotaping that have been shown to really help with pain and getting back to normal activities in the short term. So the takeaway here is pretty clear, right? For most people, starting with a skilled physical therapist is a fantastic first move. It's not invasive, and it gets right to the heart of the problem by addressing the mechanical issues causing all the pain. But, okay, what if physical therapy just isn't cutting it? For people with that really persistent pain, there's a next step up the treatment ladder, and that involves more targeted, minimally invasive procedures. So, what are we talking about here? Well, there are a few key options. You have targeted corticosteroid injections, which go right to the source to bring down inflammation. Then there's something called a ganglion impaired nerve block. That's an injection that basically numbs the main nerve hub that sends pain signals from your tailbone up to your brain. And for even longer lasting relief, there are radiofrequency therapies that use a bit of heat to kind of turn off those same pain sensing nerves.
And what's so crucial is that these aren't just blind shots in the dark. As you can see here, they're done using imaging guidance, like a live X-ray or a CT scan. This lets the doctor guide the needle with absolute precision, making sure the medicine gets to the exact spot where the pain signals are coming from, like for this ganglion and car block.
Now for a very small group of patients, the ones with that confirmed severe instability who have tried everything else and gotten no relief, there is a final option. It's surgery, and it's called a coccydyectomy. And that is the complete surgical removal of the tailbone. I know, that sounds pretty extreme, right? But you have to understand, for the right person, this can be absolutely life-changing. A huge analysis of all the studies found that a whopping 84%, 84, of carefully chosen patients who had the surgery got significant relief from their pain. But of course, any surgery is a trade-off. You've got that incredibly high 84% success rate for pain relief, but on the other side, there is a risk of complications, like an infection in about 8% of cases. So it's a huge decision, no doubt, but for that carefully selected patient, the odds of success are very, very good. And this is exactly why doctors are so incredibly careful about who they recommend for surgery. You have to check a lot of boxes to even be considered. First, you have to have tried at least 6 months of conservative treatments without success. You've got to have that proof, that confirmed instability on the dynamic X-ray. And this last one is critical. You need to have gotten at least 50% temporary relief from one of those targeted injections. That's like the final test, proving beyond a shadow of a doubt that the tailbone is the real source of the pain. All right, so let's wrap all of this up. If this is a journey you're on, what are the absolute key takeaways for finding relief? You know, if there's just one thing you take away from all this, I hope it's a message of hope. Coccydynia isn't some untreatable mystery. It has a cause that we can find, and there is a clear, step-by-step ladder of treatments to climb. Getting real, lasting relief is not just a dream, it's absolutely possible. Really, it all boils down to one thing. The entire journey to feeling better starts with getting the right diagnosis. You just can't treat what you can't see. So if you or someone you care about is dealing with this kind of invisible pain, the question you have to ask is, are you asking the right questions? Are you pushing for the tests, like that dynamic X-ray, that can finally make the problem visible and solvable?